we're suggesting here is that the two cities team up and look at what they've got, take what they can learn from the best of both sides. We have two recommendations for food. So the first one is to set municipal standards for foods purchased by public agencies. And here, this is another example where both cities have standards in place. So London has standards that have to do more with sustainability and ethicality and ecological implications of how the food is produced and brought into the city. And New York has its nutritional guidelines. We think that cities should be thinking more broadly about this, and that this is an area where, again, both cities could learn from each other about how to expand the guidelines that they already have in place. The next one is to reframe food safety standards to reflect current threats to health and create new ways to use the municipal food safety workforce to promote healthier eating. In practice, there's a food safety workforce in both cities. In New York City, one of the ways that they've been able to get political force behind their food policies has been to say, we used to have food safety issues that were just about foodborne illness, things like E. coli. Now the major food-related illnesses that are facing society are chronic disease. And so how can we retool a workforce that we already have in place to address these kinds of issues? Here, one thing that's been suggested is sort of building on your scores on the door schemes for food safety that's really about cleanliness, and say, well, wouldn't it be great if you could walk up to a restaurant or a shop and say, I want to go in here. I know that this fast food restaurant is committed to serving me one portion of salad with my clogs. Parks and green space, we want to promote urban agriculture. Here you have a program in place in New York City. There's a lot of interest, but we haven't had any real municipal support for food growing in cities. We'd like to see more of that. We also think it's important to increase access and safety in places where people can be physically active. So it's not just about opening up more turf areas for people to play and providing more money for sports, but it's thinking about the real life things that keep people from actually going out to the parks that are just a few blocks away from them to actually be active. Transportation, we know both cities are doing a lot to encourage people to walk and cycle and a lot to encourage children to be more active, but we think that these programs and initiatives could go farther in terms of targeting communities where there are high rates of obesity among adults and children. And then lastly, with schools, we strongly recommend implementing a universal school meal program. New York City already has universal free breakfasts. London Borough of Islington, as I mentioned, is the first borough to implement a school lunch program where it's universal free lunches for all children. And we think that there should be free meals, in both cities with nutritional standards. Lastly, we want to provide free drinking water in schools and improve the infrastructure for tap water delivery and for children to safely and comfortably use bathrooms. In New York City, we have very strict guidelines about the calorie content of beverages that can be served and sold in schools. But you have to do more than just limit the access to the sugary beverages. You need to also provide a healthy and free alternative. And tap water is something that both cities have that should be a resource better used. So in terms of research and training, Eileen has breezed through some of the epidemiological data about obesity, childhood obesity in both cities. I will just say, as someone who worked on compiling that data, the data structures could be a lot better in both places, particularly in New York City. So if we want to really address health inequalities, we need to be able to have the data that we need to see what's happening and if the policies that we've put in place are working. We think that it's really important that cities not just be consumers of evidence, but also be producers of evidence. In trying to put this report together, we were continually struck by the near complete lack of evidence for the cost effectiveness of the kind of upstream policy approaches that we're recommending and that are recommended by people from organizations around the world. There just isn't evidence for it. And that's because cities are hoping that somebody's going to produce it. We think that cities should partner with universities and become producers of this kind of evidence, really crucially evaluating the programs that they put in place. And then lastly, we think that there needs to be some training and fostering of collaboration across fields so that we can have the kind of built environment strategies that we're suggesting that now seem sort of radical become the norm. So bridging schools of planning and architecture with schools of public health and having combined training for a workforce that's really ready to handle these things right at the get-go. And so lastly, I just want to, on behalf of myself and Eileen and our collaborations, say thank you to all of you for coming. Thank you so much to the GLA Health Policy team for hosting this event and for working with us throughout the collaboration. and also to the 57 project partners who contributed to this work. We've listed all of their names in the